Dr. Linda of the Vascular Birthmarks Foundation coming to you live from Italy with our December 2022 Facebook Live with Dr. Giacomo Colletti, our VBF Europe and VBF Italy Director. I'm just checking to see the live on here so I can see your questions come in. It's not synchronized on my phone yet, but it will be soon. I'm waiting. Okay, it gives me a second. We will take your questions as soon as I'm synchronized. We're going to be here for 60 minutes answering your questions. We're just coming off of our super amazing clinic on December 9th on Friday. Let me just close this out. Are you seeing us? And let us know. You are. I'm not seeing it. It's not popped up here yet, so I won't be able to see the questions. But it'll synchronize. Let me go back out. Sometimes I have to go back out and come back in and see. Oh, there we are. All right. So we are ready to take your questions. I see Mahal is on. Dora's mom is already set a little heart out for us. So make sure you send us pictures. Post laser. Dora had her laser treatment on Friday. I don't know. Forget about that. I know. We can work around it, right? So we have 12 people. They're logging in another one. So all of you, welcome to the VBF December 2022 Facebook live from Milan, Italy, with myself and Dr. Colletti. We're just talking about the amazing clinic we had. I changed it to a super clinic because it was not just free laser, it was free ultrasound, free consultations. Yeah. And sometimes you even do dental exams, right?
When it's needed, sure.
When it's needed.
Being a maxillofacial surgeon, I can be of help there.
So we can just ignore that, right?
Yeah, you can.
Okay, I'll just ignore that. So we have 60 minutes to take your questions. We were just talking, and Dr. Colletti will be at our massive conference next year, October, Columbus weekend in New York City. That is when we go back to our in-person talks, which you're happy about.
Yeah,
they'll be They'll be at NYU. The clinics will be at Dr. Geronimus's office, and the dental and the ultrasounds will be at the NYU Dentistry School. All of this is within one block. So we'll go live with registration for that in February.
That what VBF organizes every year is unique, meaning you are able to come and see some of the most world-renowned experts for vascular anomalies and see them all in person. So it's not unusual for those patients to come to finally receive an appropriate diagnosis, plus, of course, there is a chance to be treated for free with the laser. And again, those who will perform the laser are not some laserists, are those who basically invented and perfected the laser treatment for vascular birthmarks. So again, I believe it's a unique occasion, and I'm so happy and very much proud to be the one who's doing this in Italy. Again, I think we serve not just Italy, but everyone from Europe or Northern Africa, even Middle East, is more than welcome to come and see us. And sometimes we can really be of help.
Well, we had 22 countries represented, from Moldova to Romania to Hungary to Holland, Norway, Greece, Italy was like the least,
Yes.
So, and we have quite a few people on. Ava Piles is saying hi, Dr. Colletti, and we got to give a shout out to Scott. Today's his birthday, so happy birthday,
Happy
Scott.
birthday, Scott.
Sebastian,
and congratulations for your wedding.
Recent wedding. Mentor is saying hi from Albania. He was just there. Caitlin Smith is saying hi to you from Alaska. So we have Dragana Dvorak is watching us. So we are ready. Australia is on right now. Giuliani Brianti from Italy, Emilia and Giulia.
Those are the parents of my Emilia.
And actually we have Mary is writing from Boston, who's logged in. So here we are in Italy, and and Quebec is on now. So hello.
This is the beauty of today's technology.
Yeah, and this is my January of 2023 starts my 6th year of doing a Facebook Live every month, even all through COVID, never missing
Quite
a
a
beat.
lot, isn't it?
And we've had 150,000 1-hour views of all of our lives.
Wow.
So that's all pure real-time education for our families. We are actually, we have Belgium on now, Greece. We are ready to take your questions. So Dr. Colletti is only here for 54 more minutes. So diagnosis, classification, treatment. I know before the questions come in, you're excited about some new techniques you're perfecting for AVMs.
Yes.
Correct? You're getting excited about that to give hope to our families with the extracranial AVMs.
Yeah, I think the field of arteriovenous malformation, it's not just my idea, it's the most difficult of all vascular anomalies, because those are very aggressive diseases where there is bleeding, pain, and treating those AVMs, it's tricky. And we're doing a lot of research to try and offer new techniques. Some of them you, Linda, are aware of, like electrochemotherapy, where we are able to manage even massive AVMs without the need for surgery. It's a midway between interventional radiology and I should say oncology, not that we are doing oncologic treatments, but the electrical pulses that we deliver are made possible by a machine that was originally conceived to treat not operable cancers, so to reduce them. And they seem to work, these techniques seem to work really well. I mean, those patients that we have treated are greatly satisfied, and we could see with the ultrasound and other imaging dramatic reduction in the size of the AVM and its activity. So I believe that this is going to be more and more used, not just by us, but probably around the world.
The way of the future.
Yeah,
now
probably.
You called
at least for some of them.
You called it electrochemotherapy.
Yes.
Isn't it more electrosclerotherapy?
It's electrosclerotherapy.
Okay,
Yes.
I just don't want some people to think
Yeah.
it's a chemo like cancer,
No.
even though it's a process similar.
Yes.
It's electrosclerotherapy, which they're more used to with vascular anomalies.
Yes. Yes.
Okay, we have questions coming in. Caitlin Smith says her port wine is on the hair port wine is on the scalp under the hair. Would the laser affect the hair?
Oh yes. The PDL can destroy the hair follicle, so I never do treat the port wine stain that lies in the scalp, because it will hardly be visible, so not an aesthetic concern. Whereas if you do treat it, you will cause baldness. So I never treat the scalp as well as the eyebrow. I think this is the way to go.
Thank you. This is a great comment, because Dora was one of the patients you treated on Friday, and her mom said, you know, we've been all over, and the treatments Dora gets in Italy have been the best.
Oh, really?
And I think she's saying it's the best overall experience. Because as you and I know, these experiences can be traumatic.
Oh, yes.
And we're addressing that, because I
Well,
want
yeah,
less
first
pain
of all,
more
we
pain.
have to say that Dora is our superstar, isn't she?
And her mom said that too.
Yeah.
She was very brave, but she really is a
our
superstar.
Yeah.
Yep. Jasmine wants to know what % of individuals with a CM AVM will experience an AVM on the brain or spine?
That is very difficult to say. It's highly variable. So we cannot say 10%, 50% of those affected by CM AVM will have a brain or spine AVM. However, there is the chance, the risk that there is one or that one will become apparent later on in life. So patients with CM AVM should routinely be checked for CNS AVMs or fistulas.
Stephanie has a great question. Would the electrosclerotherapy work on a big venous malformation on the ear and neck?
Yes, it will work. I do use electrosclerotherapy on venous malformations as well, but it's by far not my favorite approach because in my hands, venous malformations treated with my, I should call it cocktail of sclerosants respond exceedingly well. So I very rarely rely on electrosclerotherapy to treat those.
One more question from Caitlin.
Some colleagues in the world prefer that, though,
Thank you.
especially in Germany.
One more question from Caitlin. So she wants to know if they don't treat the stain under the hair, will it thicken, enlarge, and swell under the hair?
There will be some thickening, a little, yes. This is not going to be a concern for the patient. Sometimes, though, much later on, there could be some pyogenic granulomas popping out, and those can be quite annoying because they can be itchy and they can be mildly bleeding. So when they appear, we usually remove them surgically. It's a very minor surgery, so it doesn't change the fact that we don't treat the port wine stain of the scalp.
Thank you for that. Dustin wants to know, our 7-month-old daughter just got approved to have the blebs on her leg cauterized with the laser next month by our dermatologist. Do you have any advice we need to...
7 months old?
Yeah, I don't know what blebs would be on a 7-month-old.
Probably...
angiokeratoma?
I don't know.
We'd have to see.
It would be very early for pyogenic granulomas to appear.
Yeah.
I would be very surprised if they were. So we should have a more appropriate, specific diagnosis before I can recommend anything to you.
Yeah, Dustin, we just don't know what you're talking about because it can't be a port wine because they don't have blebs at 7 months.
Usually they don't.
Usually don't, but it
can happen though.
It can be a type of...
It can happen.
Yeah, it can be a type of malformation or...
Now sometimes, although very rarely so, pyogenic granulomas can appear somehow early in port wine stain, but it's very rare.
Right. So, Dustin, what you can do is email some pictures and details to me, and then I'll share them with Dr. Colletti in our chat group. So we need to see what it looks like, and a little more history, what was present at birth, has she had any treatment, are the legs symmetrical, is there any discrepancy between the legs, etc. Jasmine said she wants to move to Italy so she can get proper treatment. I love that.
Too.
It's funny. Good one, Jasmine. I had an ultrasound and then treated at the clinic in MA last month. Already the change in my birthmark is amazing. Also, to my surprise, Dr. Colletti found out what I thought was a port wine is in fact some other kind. That's Mary, who came to our Boston clinic. Mary Westmoreland, BZ Westmoreland. I'm not sure, I don't remember what she had, but you changed the diagnosis, and we did that on a couple cases.
Yeah, definitely.
So, Hillary wants to know, Hillary's been in our network for a long time, how is the electrosclerotherapy administered, with wire? Does it burn the AVM?
So electrosclerotherapy is, in principle, consists in the fact that you inject some sclerosant around the nidus of the AVM, then you put quite a lot, in fact, needles in the nidus, and you have some electrical current passing through those needles. that electrical current will open the cell membrane because it will depolarize it. So at that point, being the membrane open, bleomycin will get inside the cell and do what it's supposed to be. So kill diseased endothelial cells. It has to be done under general anesthesia. It's not painful. You can expect swelling after the procedure, and sometimes in major AVMs, some oozing through those holes where we pass the needles, and that oozing paradoxically is something that we want to see because it's cells dying that will get out of those holes. Not a big discomfort for the patient, but you have to know that so you are not scared when it happens.
Thank you. So, and Sophia, who's monitoring us today. Hi, Sophia.
Hi,
Could
Sophia.
you please post Dr. Colletti's email and mine as well for the people that were asking to send additional information? Deb Peters wants to know, this process you're talking about,
Yes.
this electrosclerotherapy, will it work on a venous malformation in the leg?
It will.
Have you done any extremity lesions with it yet? Or?
Not yet.
But in
no.
theory it'll work.
It will work.
It will work. Marina wants to know, my son Grego is a patient from Dr. Colletti.
Yeah.
He had his first
Grego.
seizure 2 weeks ago. He started his
I
Keppra
love
medicine. Luckily, his CT and MR is clear. What does that mean regarding Sturge-Weber? And how old
Can you
is he?
say that again?
So she said that Grego, I don't know how old he is, but she said the MRI and the CT are clear.
Yes.
So what does that mean regarding it? How long do we have to wait?
Actually, having an early MRI sadly doesn't tell us that Gergo doesn't have Sturge-Weber's, because until he turns 1, there's still a very high chance, provided the clinical features are coherent with those of the Sturge-Weber's, which Gergo has, unluckily. So an early MRI or CT scan will not necessarily tell us he doesn't have it. It will, though, tell us that he doesn't have it yet. So you shouldn't expect seizures now, but we have to wait until he turns 1 at least before we are safer.
Out of the woods,
Yes.
as we say.
Yes.
So I think I know what Christian Kazan is saying. They want to know, when do you begin any treatments for a birthmark that is caused by Sturge-Weber, which the birthmark's not caused by Sturge-Weber, but
It's an association.
Yes, if a patient has a port wine and associated
I
either
start
glaucoma
immediately.
or seizure,
Doesn't-
the laser you do, right?
The laser, yes.
And then they should be monitored in case they need the medication
Yes.
for seizure, and definitely eye exam because they may need the drops for the glaucoma.
Yes. However, what I feel the need to recommend is that a baby with suspected Sturge-Weber is followed by a very expert pediatric neurologist, confident on how to properly manage a baby with Sturge-Weber's, because there are different approaches. I have the best in my mind, but yes, you should see a pediatric neurologist with experience, a very good one in Sturge-Weber's.
And our 2 Sturge-Weber experts have agreed to come back next fall, so we know we have that for our parents. They can come back and have a follow-up.
Those are not just neurologists; those
They're
are
like
the
the
world's
leading, Like Dr. Pinto
world's
from
leading
Boston
neurologists.
Children's,
Yes.
and Dr. Anconi from Hopkins, 2 of VBF experts that we brought here. That these connections that VBF is making around the world are just unbelievable.
Yeah.
A good one from Christine, and she heard what you said about you don't have to shave the head, but the baby's only 3 weeks old and going to start laser, and the sting goes just past the hairline. Should she shave it?
No, you should not treat the area in the scalp where there are hairs. Don't go there. with the laser.
It's on the baby's ear, so the ear you can treat.
You can treat. I always treat the ear.
And
yes.
you should, especially when they're young, right?
Yeah.
To prevent it. Elise says, how much frequency would you recommend for laser for a person with Sturge Weber and major port wine? My daughter is 7, severe epilepsy, 7 years old. Severe glaucoma, severe epilepsy. Is there a potential of help between the treatments with sirolimus?
Okay, so there's more than one question.
Yes.
The first one is how often. So the issue here is that your daughter is 7 years old with Sturge Weber's, so most likely she will not tolerate treatment without general anesthesia, and I would not feel comfortable in recommending more than maybe 2 or 3 treatments a year, since she has to go under to be treated. And the second one is sirolimus. Well, we were discussing just 2 days ago things with Ankomi. She says that there is a potential role for sirolimus in managing or making seizures less likely, but personally I don't have experience with it, so I cannot really make a recommendation on this.
I can say, because VBF is participating in her study, that there's been some preliminary positive outcomes from her pilot study with reduction in neural seizure type activity with the sirolimus. We're hoping that this is the future and that it'll help, but it's early. By next November, when we're back here, maybe we'll have something more exciting to report.
I very much look forward to it.
Me too. Our buddy Mentor is on, that comes and sees you. Hi, Mentor. Now, Mentor, I'm going to say this to you again. You do not have a hemangioma. You have a port wine stain. You have to stop registering that you have a hemangioma, because only infants have hemangiomas. Babies have them and they go away. So your
infantile hemangiomas.
But he registers and says it's a hemangioma. You have a port wine stain or a capillary malformation. No one can predict how many treatments will make it go away. Each treatment you get, you have to see the settings, how you respond, and you just keep going until you're comfortable with where it's at. I mean, I just don't know. But we do believe, VBF and our experts, Dr. Giacomo, Dr. Rox Anderson, Dr. Nielsen, Dr. Colletti, the top 4 heavy hitters, they all believe in infants. Start as soon as you can. In infancy, the laser loves the hemoglobin of a baby. The vessels respond better. The skin
is thinner. Vessels are smaller.
And the face is this big.
Yeah.
So it's like
the absolute surface is smaller.
So small.
Than it will become later on.
Yep. Okay. Next one.
And there's less melanin too.
Torger says, thank you, Dr. Colletti, for treating our son Aaron on
My
Friday. He was the girl that turned out to be a boy. Our that we kept saying.
No, it turned out to be a boy, and I said a girl because he's so beautiful.
Oh, okay.
I thought it was a girl.
He said,
congratulations.
He said his dermatologist in Norway, which is very interesting that they came, wants to purchase and start using metal eye shield. Bravo.
Yeah.
I noticed the one you used was white in color, not metal color, and without pin to hold on to.
Yeah.
What made you choose this lens, and how many different sizes are there? Maybe we can get in this info.
Yeah, you can write to me so I can also tell you how to and where to buy them.
Yeah, that's probably the best way.
Yeah.
And Sophia's posting, so please post Dr. Colletti's email. Shaza writes, Jax was treated by Dr. Colletti on Friday, so all our families are writing in. When would you advise to start looking at another session? There's nowhere in the UK, and that's a conversation I've been having for 4 years, is to get a VBF clinic in the UK. Right now, we don't have one.
So I'm not sure if he is 7 or 9. I think he's 9 months old. So I'm trying to make my philosophy clear here. So my philosophy is to try and clear as much as you can before, way before ideally, but still before baby turns 2. So in order to reach that, you should have a treatment every 4 to 6 weeks. As soon as the purpura goes away, do the treatment.
And Torger, just so you know, Dr. Colletti has the VBF flat fee, which is 500 euros no matter the size, and no matter how many treatments, it's 500 euros each treatment, no matter what the age or the size, at the studio. He will also be in Greece in June of next year, where we'll have the free clinic, and then again in November back in Italy. Okay, so Sheza Daly said Jax was treated on Friday. When would you advise to start okay, so we just answered that.
Yeah.
Nicole wants to know, are there any new treatments for port wine on the gums? Once you suggested a periosteum removed and was curious if this is common. Thanks for all that you do. We hope to schedule a consult with you soon. That's Nicole Muse.
Yeah, gums and periosteum, those are 2 totally different issues. As far as the periosteum goes, this helps in trying to reduce, ideally stop the overgrowth that affects a maxilla of a baby who has a port wine stain. So I say it depends. I would start considering stripping the periosteum of the maxilla around the age of 5-6.
Thank you for that. Now,
And it's very common, by the way.
A lot of the patients that Dr. Comey and Dr. Pinto spoke to on Friday, because then they spoke to me, and I know their philosophies, and they do prescribe prophylactically a very low dose of aspirin.
Yes.
And this Karen Schneider wants to know, what's your opinion on low dose aspirin in Sturge-Weber syndrome?
We discussed this with Dr. Comey and Dr. Pinto when we were having dinner together, and it's maybe not as effective as we thought it could have been, but it's not. It doesn't do any harm, so you can start as soon as you want.
Thank you. So Sebastiani is asking me a question about the thermal regulation project.
Yes.
And yes, the answer is Dr. Colletti and I saw some amazing before and after results that were presented by our friend Barb Humphreys from Alberta, Canada. She's the first one to pilot my project, and they are seeing results of clearance from port wines that were resistant or had reached their maximum clearance. So I'm excited to see your post-laser pictures over the next few months, so please send those to me, Sebastiani, so we can share them. Hi Jody. Jody Lee is saying hi to Dr. Colletti, Dr. Linda. She said, you evaluated my beauty, Megana in Irvine in October, and recommended bleomycin injection for her lip. It's been 2 months, and we have noticed increased dryness, bleeding, cracking, and small growth. I know it is winter here in Michigan, so the weather doesn't help with the skin changes, but we are wondering when we need to really be serious about getting this injection for her.
So I think we discussed this in person. We have to be careful by giving an indication to inject bleomycin. In my experience, it is very helpful in trying to curb or even stop the risk of hypertrophy. So I think I told you that. I said if you are pretty sure that there is a tendency towards hypertrophy, then I think we should start it sooner rather than later.
The other thing, Jody, is it's likely we will have a low-key, but we have a meeting we're attending in April in Boston, and we're going to try to set up a little clinic for like a half a day, and that would be a good time for Megana to come and see you, because it's 6 months from when she saw you in California. And Jody has family in Boston, so she'll have a great time. Christine wants to know, in your opinion, how often should infants have laser and how soon together can they do them?
I'm not. Can you repeat that question?
How often should infants have laser treatments for a port wine?
Yeah.
And how close together can they be?
I usually recommend doing treatment every 4 to 6 weeks.
Sean, hi Sean. You're not missing this. You can always go back. So Sean is one of our physicians. He has a beautiful little baby with port wine stain, Sturge
Hi,
Weber.
Sean.
And he testified and spoke on our behalf at our federal legislation day on Capitol Hill. So is there a minimum starting age for this electrosclerotherapy? Have you seen pulmonary fibrosis as a result? I imagine bleo doses are small, and obviously he's a doctor, so he's...
So pulmonary fibrosis is the most feared complication of bleomycin in general, not in electrosclerotherapy. So I prefer not to answer. I can answer with my experience, and my experience, short answer is 0, not a single case. But aside from my experience, which may not be science, I can tell you that there is literature on it, meta-analysis. You can go and PubMed it if you want. Analyzing all the literature of the last 10 years, there wasn't a single documented case of pulmonary fibrosis after using bleomycin for vascular anomalies. The way bleomycin is administered as a chemotherapy drug is totally different. Different are the ways through which is administered. Different are the doses. So you shouldn't really consider bleomycin at risk for pulmonary fibrosis when it's used in the ways and dosage that we do use for vascular anomalies.
And then, by the way, everybody watching that's really obviously interested in this, because we're talking about this new treatment technique. I'm hoping when I come back in February to be able to video you doing one of these procedures.
Yeah.
And so that's...
You saw some of the results.
I saw the results are mind-blowing. Just the biggest hope I've seen in decades.
Yeah.
So I'm fingers crossed and praying. Stephanie wants to know, her daughter is 1.5 to 1.5 years old and has a big venous malformation on her ear and neck. She has already had 2 sclerotherapies and they want to start with medication, but I think it will take too long, a lot of years, until we see an effect. And the doctors say we will not have a nice result. Isn't surgery a better approach? I guess you'd have to see the pictures.
First of all, I would like to point out that sclerotherapy, when you say sclerotherapy, you're saying I'm driving a car from A to B. Okay. You could drive different kind of cars through different roads and with different drivers. So there are a lot of different substances that one can rely on for sclerotherapy. There are different dosages, different way of doing it. So I always tell my patients, yes, you're telling me that sclerotherapy has failed in the past, but I always want to try it my way before I say it's not effective.
And by the way, for those of you that are asking a lot more questions on the thermal regulation project that I started last year, or actually this year, the concept of it is to preheat the skin.
I think, Linda, I was the first one trying it.
You were.
After you said it.
You liked the idea.
I do.
But you have to safely preheat the skin,
yes,
so you're not damaging any surrounding tissue. This is why this was abandoned, because in the past they were using lasers that were doing tissue destruction, so they abandoned the project. But then I started resurrecting it, realizing they have all these new cosmetic lasers out that do not have thermal damage but can increase the superficial temperature of the skin.
Yes.
So then once you heat the skin, Then you use the typical pulse dye laser, which has a dynamic cooling. Everything's the same. You're just warming the skin
Yes.
before laser, and then everything is the same. So I think that
Warming means dilating vessels, so more hemoglobin, which is the target for port wine stains. So it's, I mean, totally makes sense.
Oh, and Denise said, thank you so much for the better diagnosis you gave me. It was such an honor to talk to you. And that's...
You are more than welcome.
The woman
anytime.
that we thought had the AVM, but she has the venous malformation
Yes.
in the jaw.
Yes.
And like I said, Denise, Dr. Colletti, and I will be in Boston in April, so that'll be another chance. We'll post something out there when we are there. Jasmine says, what does evidence-based research say about steroid injections for a small raised infantile hemangioma?
Evidence-based medicine says that there is a role for it. Steroids can be administered in infantile hemangiomas either systemically or by local injections. I honestly prefer injections. However, indications to treat with steroids are less and less over time. However, if your son or daughter has an indication to it, then probably local injections would be my preferred way of doing it.
Caitlin Smith, if you go to our website at birthmark.org, you'll see right on the front page all of our free laser clinics around the world. We have one coming up in Houston in January, Miami in February. We're not sure yet if we'll be doing laser in April in Boston, but we definitely could do the ultrasound and the consultation clinics. Hopefully we'll be able to do laser, but we can maybe go to Candela to do those.
Yeah.
But anyways, our big conference is in October every year at Dr. G's, and that's in October with free lasers. So if you go to our website, birthmark.org, right on the front page, you'll always see all of our laser clinics, and you can reach out to me to find out if they're not all there. But we roll them out several months before they're launching, and Miami is just getting ready to launch, which is in the end of February. Jenna says, we are being seen in Boston. Our MD was hesitant until our insurance covered. We had one session with general anesthesia. I'm not sure what the child has, maybe what she'll get to it.
Probably laser.
Yeah, with GA, we'd have another coming up. It's been 2 months. How many times would you be comfortable having a child under GA in 1 year? Our son is 17 months old. After treatment, we are considering and have been seen by an MD at Yale. That would be Dr. Antaya, who I'm working with on my project, who will not use GA, but due to the size, will only do a section at the time. Should we do some with GA and some not, feeling a little lost? Our son starts at the top of his bum and goes all the way down both legs and feet.
I would not suggest doing more than 2-3 maximum sessions of GA before the age of 3. Definitely not.
So then would you laser this in sections if it's
Yeah.
pretty extensive?
Yeah.
And there's no harm with that.
No. This is what I do, actually. And you know that.
Right. So Torger wants to know what the white cream was that they put on after the laser.
That was... forgot the name. I can tell you the numbing cream is Playeglis, but the moisturizing one, I'm sorry, I'm not sure.
I don't know what it is either, but we can find out and share it with you if you want to write. Wu Shan says, hello doctor, for VM case in the leg, ethanol, embolization, alcohol, there's good or sclerotherapy because my 4-year-old son has VM of her leg. So
Yeah.
I guess he's asking what the options are.
Yeah, ethanol, it's not embolization, it's scleroembolization, which is different. It's very effective. It's one of the preferred ways of managing venous malformations of the limbs. But again, who does it? The operator, I mean, has to be very experienced because it's the most effective but also very difficult to manage. So it is a very good choice just be sure that the doctor who does it is experienced enough.
Thank you. Thank you, Ray. Ray Matt says, ciao, Dr. Colletti and Dr. Linda. Thanks for hosting these sessions and always having our backs. We like to hear that. Ram Malka says, hi, does lymphatic malformation of the tongue and base of tongue cause sleep apnea? I had 2 spirals with Leo with decent results. Second question, how long it lasts before it regrows again?
So, sleep apnea is definitely linked to lymphatic malformations of the airways in general, especially in the tongue or the pharynx or the palate. Bleomycin is a very good way of dealing with it. However, in my experience, it's not always enough. So sometimes you have to surgically reduce the tongue and or do other surgical procedures in order to prevent or correct the sleep disturbance.
Thank you for that. And Joey Davidow says she's already
Hi,
seeing
Joey.
improvements. So that's really great for those of you that
Yeah, actually, I saw her day before yesterday, and I was surprised by the amount of effectiveness that I observed after we last treated her last
treatment,
year.
Yeah. Well, she had a long time in between, and that's another thing that gives hope for. We had that one woman who hasn't had any laser in the UK for over almost 20 some years, and she's excited about the result that will come. So it doesn't matter about age. It's preferable to start in infancy, but what we really
best results are come out of earliest treatments, but this doesn't mean that you can't get results later on in life.
That's right. There's no age. We've had patients in their late 70s.
Late 70s.
And patients come almost right from the hospital to the clinic, as Dr. Geronimo says. Jody says, I know Dr. Linda is aware of my new journey into craniosacral therapy. I just ordered a book on it to read about it by the founder of this osteopathic medicine. She wants to know if you've heard of it. I'm learning more and more about it, trying to see how it could potentially be a benefit to our community with more of a emotional, psychosocial benefit, but also for chronic pain relief. I think it's worth.
Again, what I try to do on my daily practice is, when it's feasible and possible, to rely on the best scientific evidence that we can. So I haven't read about it, but I'm more than willing to do so.
Thank you. So Bhushan, at birthmark.org, where it says find a doctor, you'll see the drop down. Put in India for the country. We have 7 or 8 doctors in different regions of India for your left leg. We do not have a plan on coming back. We were there in 2012 to launch clinics in India, and each year we go to a different country, and we haven't done any because of COVID, but we'll be back in Greece next year. So we don't have any plans, but you can go to birthmark.org and find a list of physicians that are in India. And again, look for an interventional radiologist if it's an extremity lesion that's a venous malformation. So when you look on the list, look to see that they have an interventional radiologist. Thank you, Yasmin. Jasmine said she'd like to be a volunteer at the next clinic in Massachusetts if possible. Reach out to Scott, our Global Ambassador Director, about that. Torger said, at what age do you recommend to start and stop GA when treating with PDL?
Start after the age of 3. So I usually stop treatments at the age of 2 and wait until the age of 3. You can do one session of GA in between, but then I start with GA after the age of 3.
So why do you stop? I mean, do you stop at age 2 or just sometimes at 2? And then just wait to 3, because I didn't know if there's a reason you had this gap.
There is a reason,
Okay.
So the reason is that if you do treatments without anesthesia, the baby will not be able to remember those experiences when he's younger than 2. But the older you get, after the age of 2, the more likely it will be that the baby will have some memory of those sessions. So I usually stop it, but I don't start immediately thereafter with GA, because there's a risk that repeated GAs before the age of 3 may impair the development of the central nervous system. So I stop at the age of 2 and start back again with GA after the age of 3.
Okay, thank you for that. Very important information for our families making decisions on, especially, when you hear some families say their child is 2 years old and they've had 6 general anesthesias and they're under 2. It's very scary.
No, it shouldn't be. You shouldn't be scared because the evidence we have is not definitive. Okay, so we always talk about relative risk, not that you're sure that your son or daughter will have some form of impairment of CNS development, but still, that would never be my first choice.
And also, shout out for our laser guidelines project we're working on, which we should be done with next April. And we're looking for our anesthesia volunteer to give us some recommendations for some more comfort options that are not passing the brain. Yeah. And that's one of my dreams, is to have more clearance with less pain, so that the children can have less distress. Yes. Right? And we talk about this all the time. Matter of fact, Leslie's like, I need to come to your next clinic in next year, so that'll be next November. So keep it in mind, Leslie, to come to Milan next November, and maybe we can get some people here to learn some of her tricks to integrate them into the practice, because that's what it's all about. We have 13 minutes left. We're happy to take your calls. And by the way, Jody has a doctorate degree in physical therapy, so she's a qualified PT expert. And I am very excited about if this is a possible, the craniosacral therapy, even post-op. Or there's some minor techniques we can teach parents even.
I don't have enough knowledge to say yes or no.
Well, she's going to give it to us, and I'm excited. And maybe next year at the conference in October, we'll be able to have a preview of what we're hoping to see. And aside from the port wine treatments that you're doing and the AVMs that are novel, are you thinking of anything new for the port wines, like along the lines with this electrosclerotherapy? Do you see that may be something in the future for port wines as well?
Not electrosclerotherapy, because bleomycin may not be the right drug to treat port wine stains, but we are doing research on something else. Okay. So it may be that electroporation with another drug may help drastically reducing the aspect of port wine stain. But that's too early to say.
Now, one of the people asked, and I passed it too quickly, but what is your thoughts on topical rapamycin in conjunction with lasering? Is it going to be more effective?
So I discussed this recently at a meeting. You were there. So again, there is literature on this, and it appears that rapamycin doesn't really makes a difference, sadly.
Thank you for that. Can you read that? She's writing it in Spanish. Como me gustaría que interpretaran en español para
aprender por mi niño que tiene el Verna.
She's just saying she needs to ask you a question in special.
Translation. She needs translation.
Okay, so you can email Dr. Colletti and we can use the translator
Yes.
for the.
Well, I know
I
Spanish.
know you know
so-
Spanish, that's why I didn't know if she's just saying she needs it.
Yeah.
So Maria, you can ask your question in Spanish or you can send it to Dr. Colletti directly in Spanish. His email is above if you scroll back up. We have 10 minutes left. Once again, Dr. Colletti will definitely be in the U.S. in April. We're hoping to have some kind of a small, even a half a day, where we can do some ultrasounds, possibly laser. We're hoping, not guaranteed, but we can at least do consultations and the ultrasounds and do some follow-up.
Actually, I think I am in the U.S. at least twice a year.
Yeah, that
Yeah.
it seems to be happening that way. And next year, October in New York. So then April in Boston, and then I have to get those dates because of the ASLMS meeting in April.
Yeah.
And making sure it doesn't, conflict. Not yet, Jody. Well, I do know the dates of the ISFA meeting, and I do know the date of the ASLMS meeting. They're both in April. I just don't know them off my head. I can look them up when I get back to the U.S. and let you know when they are, Jody, so you can plan. And even if I'm at the ASLMS and Dr. Colletti's in Boston and I'm not able to be there, you can still have the consultation with him.
Yeah.
I'll arrange for the chance to have those consultations. I'll make sure we have it. We have 9 minutes left, and another thing I'd like to bring up with you is there are so many patients. I answered about 9 emails yesterday of patients that had been on Hemangioal or the generic beta blocker long after 1.5, 2 years old. They come off of it and it just rebounds. When do we say it's enough is enough, with these drugs?
There is no way we can tell. This is the short answer. I saw patients, babies, who were under propranolol for 2 years, that after suspending the medication had a rebound. This is very rare, but it can happen. So there is no way I can tell you how long your child should be on propranolol. There is an average, okay, but every single case is different.
Thank you for that. Bhushan, what you do is you go to birthmark.org. There's a red button on the top that says find a doctor. Then you have to go down and select the country. Click on India and then hit search. If you can't find it, I'll get the link for you tonight, and you can email me. My email is in this, vbfpresident@gmail.com. I'll get the link and send you the list of all the doctors. Melinda Anderson says, hi Dr. Linda and Dr. Colletti. I missed the new treatment upcoming for Port Weinstein's. Bennett's been on a break from treatment, but I want to start up again with Dr. Nelson. Dr. Nelson's not doing the thermal regulation project yet. I'm hoping with our findings that he'll join the few doctors we have around the world that are doing it. So right now it's just really Dr. Colletti, Dr. Antaya at Yale, and Barb Humphreys in Canada. And by the way, Dr. Colletti's partner, Dr. Matteo Tretti Clementoni, was really impressed with the purpura that he saw. So that was a good sign, that he saw some good purpura. So she just wrote this in Spanish. Mi niño, so her child.
Yeah. Niño quiere lo laser.
Oh, we have no
So
way
in
of-
laser, she's asking us if there is someone or some VBF event near Las Vegas.
We have no doctors in Las Vegas, Nevada. She should go to Dr. Garden in Chicago. He's our closest one. And then there's in Michigan, we have Dr. Oranger. Like, she can go to our website at birthmark.org under Find a Doctor and look around the states that are close to her and find out who she could see. Okay, so we have 5 minutes left. We don't want anyone who, if I missed one of your questions, you can ask it again. We have 5 minutes. Once again, this video will live forever. So on our Facebook page, as soon as I click the end this video, it will be live within a minute. You can go back from the beginning and watch it all the way through. Also at birthmark.org, if you look up in the upper right corner of our website, you'll see an icon for YouTube, Instagram, and Twitter. If you click on the YouTube button, it will give you, every time I've gone live with Dr. Colletti or Dr. Geronimo or Dr. Nelson, there's, since January of 2017, one a month. So there's over 60 videos, expert opinions, everything you'll ever want to know. We also have booklets on our website for port wine, Stearns Weber hemangiomas, soon to be lymphatic malformations, which will give you frequently asked questions and facts. Those are free to download. Mahima says, hello, does very light port wine stain progress the same way as others and have other complications like darkening, cobbling, or thickening? As all dermatologists I saw from my daughter rejected the treatment. It's very light on her face and nobody usually notices it. So she's saying it's very, very pale.
I wouldn't treat that either.
You wouldn't treat it?
No.
Okay.
Also because very light port wine stains may be paradoxically the most difficult ones to treat, because there is a little hemoglobin there, so the target of PDL is much less. So chances are it would be less effective than you expect it to be.
But you know, with someone like that, wouldn't it be worth it to get an ultrasound like at one of our clinics so you could see like if there's...
For a very light one?
Yeah, if there's something
Not
else.
sure.
Because sometimes the light ones, I don't know.
You can try once, try and have one laser treatment and tell it yourself how effective or not it was. One will not be a big deal.
So unfortunately, Shauna, no, we do not know of any doctors in the UK who are using the latest lasers. That's why we have this VBF clinic in Milan,
There
Italy.
probably are.
We don't know who they are.
No.
Yeah, we have no, and we don't know what their level of expertise is if we don't know them. VBF will not refer to anyone unless we know they're a true expert. We know who the true experts are in the world. Not that there aren't others that are good, but we're very reluctant. All of our free laser clinics are with top of the top experts. But you can do the Milan, you know, like we just had Friday. We're going to be in Greece in June of next year, and we'll have a free laser clinic in June. So again, watch our website at birthmark.org. So Caitlin says, with the port wine on the head and the scalp, it's itching, and we know that sometimes these port wine stains get crusty and itchy.
Yes.
So she wants to know if there's anything you can do.
Not really. If again, those blebs, which are pyogenic granulomas, appear, then yes, we should have them removed surgically.
Oh gosh, Dr. Antaya, the head of the Yale group, has a question for you on
Oh,
here.
wow.
Hi, Dr. Antaya, so excited
Hi.
to see you. We talked about the thermal regulation project, and we've had a couple doctors that are trying it with great results, Dr. Antaya, so we need to regroup on this. So Dr. Antaya has a question for you. What is your opinion regarding IPL compared to PDL for port wine stains?
So, I personally don't use IPL. Many other experts in the world do, especially the ones from Northern Europe. There is some evidence that although IPL is a good option, PDL is better.
That's pretty much it in a nutshell.
Yeah.
One more question from Natia. She wants to know, if you get a laser treatment, will it come back, and how many years will it be, which no one can answer, but will the laser give a good result again?
The good result, yes. It's very unlikely that you will be healed forever from a port wine stain, because there will be always some diseased vessels left behind, and with time they will tend to present themselves again with some staining. This is why I always suggest my patients to do at least a few treatments in a year to make it stable over time.
And then once that individual stain reaches maximum clearance, do you recommend a maintenance treatment?
Right, twice a year.
Oh, twice a year.
Once or
Okay,
twice a
once
year.
or twice a year.
Yes.
This has been amazing. It's been so great to do this with you once
Yeah.
again. I'll be seeing you in February and April, and we'll regroup and do our next Facebook
Always
Live.
there for VBF.
Thank you, and thank you again. And I wish you and your family a wonderful and blessed holiday
Thank you.
season,
Same
and all
to you and
all
to
of
you
our
all.
families out there. This is our last Facebook Live for 2022. I think VBF can definitely say we're closing out this year on top. I talk about 2019 pre-COVID, where we did 20 to 30 free laser treatments a year. Now with the international free clinics and the ones in Boston and Houston, now we're over 200 a year. So that math is amazing. And we did the clinic in March here, and we had 17 patients, and this time we had 52 sign up, 38 that qualified for free lasers. So that's 100% growth.
Yeah.
And who knows where we're going. But anyways, happy holidays. God bless you all. Thank you all. And once again,
Goodbye.
go back to birthmark.org, where you can watch this over and over again to your heart's desire. Thank you all.
Goodbye.